Can you start the recording? We start? Okay, perfect. Today we do piriformis muscle resection. The landmarks is on the right side. The landmarks is the tuberosity. Then I can feel here when I touch here the tuberosity of the ischium, and the other one is the posterior landmarks of the trochanter. It's just located here, and on this line we have the first landmark is more or less 1/3 from the tuberosity laterally. We know that we have the sciatic nerve. Then the idea is to enter the first optical trocar in the axis as possible of the sciatic nerve, who is running in this manner, just a little bit more lateral from the ischiatic tuberosity. And if you see the limit of the buttock, we just go a little bit lower, because like that we'll arrive just a little bit inside the edge of the gluteus maximus. The idea is to arrive under the gluteus maximus muscle to find the sciatic nerve, and then after we will follow the nerve to try to see where is located the piriformis muscle. One trick that we will use is to mobilize the foot. If we take the foot of the patient here, and if we do an external rotation of the hip, it will give a movement. It should give a movement of the piriformis muscle, and it will help us to make the difference between the piriformis muscle and the gluteus maximus who is covering, because of course it's a muscle against another muscle. But when you move the hip like that, when you do external rotation of the hip, only the piriformis muscle will move normally. Okay, now we can start. Tuberosity here. Trochanter 1 centimeters under. Okay. I use a special trocar. It's a trocar where I can enter my camera inside, and like that I can enter under the view control. You can see on the screen, you can see the fat, you can see the skin and the fat. And I just push and I connect already the gas. On peut allumer l'insufflateur déjà, s'il vous plaît. High flow. And like that, normally I can follow more or less. Well, we will have always the alarms of the insufflator. It's normal because it will be under pressure. I just dilate gently. Can you give me the blade? Mon incision cutanée est un peu petite. Oui, merci. Oui, merci. Okay. Okay, you can see the muscles fibers. We arrive here. This is the muscles fibers. Okay. And after I arrive in the fat, which should be under the muscle. When I'm deep enough, I have to remove the tip of my instrument. And now I have to see where I am in that space. Okay. I found already a small artery there. Interesting. Now I have to create a little bit more space using my camera. And I have to create a space big enough because I will need to enter additional 50mm trocar. I have the muscle here. This muscle should be the gluteus maximus. Just increase a little bit more. I go lower because the idea is to find, if possible, the sciatic nerve, who is always embedded in some tissue, and it's not always so easy to localize, at least at the beginning. I have one pedicle here. This is interesting. Maybe this is the sciatic nerve. Just mobilize. This is the hip. I'm a bit more lateral than what I expect, I think. I'm already very high, and I should be more or less at the level where I will need to cut the muscle. This one can be a part of the piriformis, but it seems really thin for that. Okay. Just feel where I am. Yes, I'm very high already. The difficulty is always the same. Maybe is this is the piriformis probably. Non, non, il faut pas diminuer la lumière dans la salle, hein, s'il vous plaît. Yeah, this muscle can be the piriformis muscle, this one. I just do tests with my legs to see if it moves. It's always like that because you have some pedicle with this one. It can be the gluteal pedicle, one of the two gluteal pedicle. Can you take the camera once again? I just test, then I lift up the leg and I have to see. Yes, look. If normally this muscle should move better. Can you take a camera again? Because I need two hands to move the foot. Non, tu dois aller de l'autre côté parce qu'en fait, ton bras m'empêche de passer. Tu dois passer par là, s'il te plaît. Donc, the idea, we are searching a muscle who will move left and right when I will do the external rotation of the hip. Yes, you can see the muscle. You see well, huh? Do you see the muscle who is moving? Okay, then this is the piriformis muscle. The question is, I have 100% of the piriformis muscle, or if it's just a part of the piriformis muscle, that's another question. Then normally, if you look above, it's another muscle here. Okay, this one, it should be the posterior aspect of the gluteus maximus muscle. And you can see that when I move my leg, it doesn't move. Okay, that it means that the muscle is moving down. This one is the piriformis muscle, okay? No doubt. Then I have to cut this muscle. For that, I have to enter with the additional 5 millimeters trocar in the space. I just enter a little bit more lateral from the optic. I try here. 5 millimeters. Oui, merci. I don't arm the blade. I try to don't arm the blade because like that it will be less traumatic if I arrive just in a small vessel. Just help with my optic to enter better, yes. Ok, when I clean the lens. Oui, on va pouvoir prendre le ligachour. Je vais déjà juste prendre les ciseaux pour couper un petit peu les fafouilles qui sont devant mon nez. Il faudrait de quoi nettoyer un petit peu l'optique pour avoir une bonne image aussi, s'il vous plaît. On va toujours, on ne sait jamais, mais en général, j'évite de coaguler. Usually, I avoid to coagulate with the monopolar because we have a lot of small vessels where I am in my space. I think that the trocar is a bit moving back. Yes, better like that. Okay. I don't have yet I've seen the sciatic nerve. That's a little bit a problem for me because I like to know exactly where is localized the sciatic nerve just to be sure that I don't do any mistake. The sciatic nerve, I expect to have the nerve somewhere here. It's always embedded in some tissue. We don't see directly the nerve. We have to open the layer which is around the nerve. This one is a sciatic nerve. Yeah, this one is a sciatic. You can see very well. Huh? Okay, and I'm pretty sure that is the muscle, is a good muscle. Just one question is concerning the small layers of muscle that I saw on the left side. This is the pedicle, and here I have also something with muscles fibers who cover here. You can see here, and this is the piriformis, who is just there. I have to preserve or close the pedicle if I can. Okay, this part of the muscle should be sacrificed for sure. But without sacrificing the pedicle itself. Tu peux ouvrir un tout petit peu le trocard, s'il te plaît, de 5 pour essayer d'évacuer un tout petit peu la fumée. We can already call the next patient. Hein? Oui, oui, ça n'aurait plus pour très longtemps déjà. Is what I told you, I'm always just with my this pedicle in front of my eyes. Okay, but it doesn't matter. Ouais, c'est toujours comme ça. J'ai toujours un problème de vue qui est un peu compliqué. Yes, I have still a little bit of muscle fibers attached here. I just want out because I see something behind. I try to enter more, a little bit more here. I've touched, unfortunately, we have to clean a little bit more the optic. We have to clean the lens because j'ai touché, ouais. Ouais, non, il faut quelque chose pour mouiller un peu. Oui, non, vas-y, donne-moi un tout petit peu de liquide déjà. Merci. On va essayer juste en mouillant un tout petit peu pour pas perdre de temps. You can see the position of the trocar. The trocar is just at this level. Huh? Non, il faudra du sérum chaud. J'ai de la buée, malheureusement. Maybe I can sacrifice also this small branch just to make my life more easy. At least I can open a little bit more. Hmm. It's really boring me. I have to make more space to have a better view. This is the tendinous of the muscle probably here, yeah. And this one is what I want to see, yes, is a tendinous, and I have to cut this one also. Yeah, you see that now it's really released, then it was something really attached there. Yeah, I close to finished here. Yes, it's the last fibers. But when I've cut the tendinous, I really feel that something was released. Huh? Suddenly, yes, the tension disappeared, and it's also the reason why it's easier for me to see because it's more mobile. I'm just careful because I have maybe something behind. The question if I have to cut more because it's inserted also above the higher, but it's clearly not this part who is compressive. Okay, you see the difference of space that I have down. It was this muscle. The pudendal is much more inside. You cannot see from here. Yeah, then it's arrived from somewhere here, and it descend on the left side. Then from this angle, it's not possible to see the pudendal. Okay, now we can see very well the body of the muscles that I've cut. Here I have a small piece of muscle. I don't know if I have to release this one also, just to be sure a little bit more. The danger is, of course, to continue to cut and finally to sacrifice another muscle with not anymore the piriformis. And I think that in this situation, maybe I will stop here because the idea is to decompress the sciatic nerve, and here it's evident that I'm already higher than the sciatic nerve origin. Just to remember, the sciatic nerve is at this location. This is the sciatic nerve. It turns in this direction and it goes under the muscle that I cut completely. And at this level, yeah, it's not compressive anymore. It can be maybe a part of the piriformis still. Because of course the movement that I did with my leg is not specific to the piriformis, but normally it should be still the piriformis, yes. Because the other nerves, the difference between the piriformis and the other nerves, the other muscles who gives the external rotation, is the only one who runs posterior from the nerve, from the sciatic nerve. All the other ones are running on the ventral side. Well, I think that better is the enemy of good enough. I don't know, what do you think? Ok. Tu peux te remettre de l'autre côté pour prendre la caméra? Je voudrais vérifier une chose. I want just know, because the muscle is cut. Yes, you have it. Just to see. Yes, you can see that this is the body of the muscle who is removed. Here. Yes, this part is still the part of the muscle. Well, I don't know. The problem is that we don't know yet exactly what is necessary and what is just an option. And the question is if we can have a regret if we don't cut completely. It's possible. And maybe I have to continue just to be sure that I will not have anything compressing anymore. No, the rotation will not be affected because you have at least two or three different muscles who gave the same effect. You have the superior gemellus muscle, you have the inferior, and you have also the internal rotatory muscle. Yes, all of them has the same function. Here the muscles is really smooth. It's also because I asked to the anesthetist to give a very good relaxation of the muscle, just to be sure that I have enough space under the gluteus maximus. Yeah, I have a small bleeder. I think that I will stop here, because if it starts to bleed here, I will regret. For me, it's not compressing. It's impossible to be compressed to be still compressive on the sciatic nerve. And on pudendal, I've cut the main part, which was this one. And probably the most important was to cut the tendinous at that level. The question, of course, is in case of nerve who goes partially inside the muscle, if we can have a good access, that's still the open question. Yeah. This is the end of the muscle, but we can live like that, I think. Okay. No drain. Normally, the patient will be discharged tomorrow. We can stop the insufflator. On peut arrêter l'insufflateur. It doesn't bleed, hein? Perfect. J'ai pas dit que c'était facile, hein? Finished. 2 scars. We close with the subcutaneous tissue, suture, and that's it. We can stop the recorder. On va rallumer la lumière extérieure. Non, non, il faut